Hello friends. So bad breath, it is such a common term. Have you ever, you must have definitely seen your family members saying this, that even after you brushing your teeth you are having that bad smell coming out from your mouth? Or you attending some event or a party and people are just turning around their faces and not having a mouth to mouth contact with you because your mouth is stinking. You yourself are feeling that stickiness or that kind of smell which is coming out from your mouth. And this unpleasant smell, halitosis or odor, mouth odor, is really unpleasant. And to treat this, we must definitely know what are the reasons behind it and what treatment should we do. Bad breath is a very common scenario which is almost found in 50% of the world's population currently, and each person in their lifetime experiences this kind of disease. So, should we neglect it because it is very common, or should we take right steps and avoid it and feel the best refreshing smile and have a good mouth odor, which is actually very appealing and pleasing to the front person also, and which is very much indicative of your good health. So come friends, in today's video let us watch what are the reasons for this bad breath, and even after brushing, why isn't that bad smell going down from your mouth? Come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah for dental related videos and facts.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, bad breath. The first thing that you experience every morning, almost everyone experiences this, and that is bad breath when you wake up straight down from your bed. So this is because of the reason why there is decreased saliva, your mouth is shut, there is no movement, and the bacteria have a free ground to play. So that's the reason why there is a typical odor every morning from your mouth. But as soon as you brush down your teeth, you rinse your mouth, this odor should go off. And yes, in most of the people it does go off. But there are times, or there are certain cases where this odor stays. And this is then called as bad breath or halitosis. So friends, let us know the very simple basic reasons for halitosis, what it can be. Because if you know the reasons, you can definitely treat it. So the first reason and the most important thing is having a build-up on your tooth which is yellowish in color, or if it has become hard, then calculus formation. So plaque and calculus build-up, which looks something like this. So if there is this kind of plaque and calculus build-up, then your mouth, even after brushing, is definitely going to stink, because this is a field of bacteria, full of bacteria, and they are continuously emitting odor from it. Now, what is the solution for this? Yes, you need to get good scaling and polishing treatment done by visiting your dentist. Then next is cavities. Yes, if you have a lot of cavities in your mouth where there is some food getting lodged, or there is again bacteria inside growing, the cavity is increasing, then surely your mouth is gonna stink. Treating and filling up this cavity is gonna help you out, and this again is gonna be done by and with the help of a dentist. Keeping clove or any other solutions, at home remedies for cavities, I would as a dentist say, please avoid it, because it is going to worsen your case and nowhere going to help you improve it. Now the third reason can be coating on your tongue. Yes, more than your teeth, your tongue is very much vulnerable to attract a lot of bacteria, and there is always a coating formed the posterior part of your tongue. If there is some kind of white coating or yellowish color, then scraping your tongue, keeping your tongue clean is going to help you to fight this odor. The fourth reason is going to be dry mouth. So there is decreased saliva production in your mouth. if this saliva has reduced, there is going to be dryness. So drinking plenty of water, having salivary substitutes, which these are substitutes which help in increasing the production of saliva, or if there are any salivary stones formed, then checking out for them and getting them treated is going to help you out. Also, dry mouth can be a condition which has come up from some side effects of medicines or some other health issues. So if that is there, then you have to check out with your physician, because he is the person who is giving you the medications, or is going to find out what are the health problems associated with your xerostomia, or what is called as dry mouth. The next reason for your bad breath is of course gonna be if you have a lot of spacing in your teeth has been removed and nothing has been replaced, or there are some artificial bridges, some caps, some implant which you are failing to keep it clean, then there is a lot of food lodgement that is happening there, and this food literally rots, decays there in that place, and then gives a bad smell. So friends, keeping them clean is the only solution. If you have caps which have been in your mouth more than 5 years, then getting them replaced, or at least visiting your dentist and asking them that do this cap need a replacement, is very much must. Also, use of interdental brush, a brush which looks like this, is very much important. This interdental brush is going to help you to clean in between the teeth and the areas below the cap or below the implant, besides implant. And flossing, if the gap is small and this brush doesn't reach there, then flossing, thread, that is a thread which is used to clean in between the teeth. This is how, if you remove the food lodged, automatically the bad breath will go off. Rinsing after every meal is very much important, because that is how it is going to help you out to have and remove and get rid of all the bacteria and the food which is lodged. So rinsing properly after every meal, after every food, is very much important. Then, if there is some kind of infection in the mouth, that is some pus discharge, gum issues, some gums have been swollen, bleeding, there's some gum infections, there is some pimple kind of thing which has come on your gums, there is some tooth which has been infected, and because of that the tooth is discharging some kind of pus, then this infection is definitely going to give you a bad taste as well as bad breath. More than people noticing it, you yourself would notice in this case. So if you get the infection right, then nothing like that. In this case, the doctors will help you by prescribing painkillers and antibiotics, and this infection will be got under control, and once the infection is under control, your bad breath will go off. Now, if there are some health issues, especially if there are some gastric, liver issues, then obviously you will have that kind of alkaline smell in your mouth, which is like, ammonic alkaline smell. So if that is there, then you will have gastric issues. If there is some sweet smell coming up, then that can be liver or related to diabetes, to acidosis, which is called as. So that kind of smell, which is very much typical from patients suffering from health issues, can also change the way you smell. Then there is sinusitis, bronchitis, lungs infection and inflammations, throat infections and inflammations. All these things can also lead to bad breath. Now, all these things, a physician is a very much first person that you should visit, because once that gets treated, automatically your breath gets under control. Now, the next is some drugs, the side effects of some drugs. Some drugs are very small, strong smelling, some acidic issues in the stomach. Then all these things can also cause you bad breath. The last one is the food that you eat, that is the strong smelling food like onion, garlic, some non-veg food which really smells strong, and this food when eaten, even your junk food at times when eaten, the oils from that food is absorbed, and that oil and that secretions are just coming out right from your mouth, and to your surprise Once you have your onion or garlic, it stays up to 48 to 72 hours. That smell, it stays there. So, right after eating this, please do not face anyone and use appropriate mouthwash so that it is masked up. You can also chew on some mints, so that can also help you down. Last but not the least is smoking. So if you are smoking, then also your lips will turn black, your tongue will turn black, and you will have dryness. Dryness leading to, yes, you said it right. It is bad breath. So quitting this habit, getting into a good routine, good healthy diet is how it is going to help you out. Now coming to the treatment part, as I have been telling you with the reasons what and how it can be treated, but let us divide at-home remedies and in the dental clinic. So at-home remedies can be fresh mint, chewing on that, it can help. Peppermint tablets or some chewing gums, sugar-free definitely, and then using appropriate mouthwash, brushing 2 times and flossing. This is how it is going to help you out. Brushing and flossing 2 times and using appropriate mouthwash. This is how it is going to help you out. To know how to brush in the correct form, watch this video. To know how to floss and use an interdental brush, watch this video. And do visit my page, Dr. Mansi Shah, for more information on bad breath and keeping your oral hygiene in a much better state. Hope you have liked this video. Press thumbs up and comment if you have any other questions related to your oral health. Wishing you all a very happy and a healthy smile. Stay healthy, stay happy, stay orofit. Thank you.